For today, we have 148 new cases who have tested positive or who have been diagnosed with COVID-19, including 12 who are epidemiologically linked, bringing our total number of cases in British Columbia to 8,543. This includes 3,094 people in the Vancouver Coastal Health Region, 4,361 people in the Fraser Health Region, 203 people in the Vancouver Island Health Region, 520 people in the Interior Health Region, 278 people in Northern Health, and 87 people who generally reside outside of Canada. We now have 1,371 active cases in British Columbia in all health authorities, of whom 61 people are hospitalized, 20 of whom are in critical care or ICU. There are 3,417 people under active public health monitoring and 6,917 people who are now fully recovered. Tragically, we've had an additional 2 people who have died from COVID-19 in British Columbia, bringing our total to 229 people. And I want to express our condolences for these 2 people who died in the last 24 hours, both of whom were in the Fraser Health Region. But I also want to express our condolences and our thoughts to an elder who died on the weekend. I was asked about this question, about this person's death in the Northern Health Region on Monday, and I've had the opportunity since then to reach out indirectly to the family. And I just want to express our deep, deep condolences, understanding how important the elders are in our communities. This was a woman who was in the Newcastle community in the north, and I want to express today our condolences and our sadness for the passing of all of the people who have died from COVID-19, but in particular, our elders. We have 1 new healthcare outbreak today at the Banfield Pavilion, a long-term care facility in Vancouver Coastal Health, and 1 outbreak to declare over, the Opal by Element in the Fraser Health Region. So that leaves us with 14 active outbreaks in their healthcare system, 9 of which are in long-term care and assisted living, and 5 acute care units. In total, 822 people have been infected in these systems, 487 residents and 335 staff. We have no new community outbreaks, but we do continue to have exposure events, as we know, around the province, and these are reported on each of the health authority websites and on the BC CDC website. We also are reporting, as you know, school exposure events, and I would like to take a moment to speak to how we are keeping parents and families and school communities informed about potential exposures and what we are asking parents to do to help keep their school communities safe. When there is a potential school exposure, the first thing that happens in all of our schools around the province is public health steps in to conduct contact tracing and assess the risk for each individual student, teacher, staff in that community. Schools issue alerts when a school exposure has occurred, and supporting these protocols, the BC CDC website and our health authority websites are also publishing school notifications. Like the health authority reporting, we started broad and we evolved our approach, and we're now reporting on smaller geographic areas, as we have on a periodic basis, because we know that that protects people's privacy, but it gives us more information. Maintaining the privacy of anyone with COVID-19 is very important. It is our responsibility, and we take that very seriously. It is also our obligation, and we will not ever publish individual health information, no matter what the circumstances. The schools reporting and the reporting on the health authorities and the BCCC websites is important. It's important because it provides public information that helps you understand what is happening in our school communities around the province. It allows parents to know where exposures are and have confidence in knowing that if they have not been contacted, their families have not had a risky exposure in a school community. We know that this has been challenging, and it's taken some time for us to develop the process and have it consistent across the province. And we also now have approximately 30 school notifications, exposure events that have happened across the province. And that is not surprising to me. We have over 2,000 schools around the province, and with millions of children going back into the schools in the last few weeks, this is to be expected. We have had no outbreaks in our school system yet, but we are monitoring, and health authorities and public health is there for every single school, and we will continue to be there as we move through this pandemic. Through this pandemic, we have been working to find the balance, and we've talked about this many times, to protect our communities, maintain capacity in our healthcare system, and keep as much as possible in our community open and functioning. How well we are able to do this is in all of our control. This fall and winter is going to bring added challenges, which will make finding our balance that much more difficult. That is why now is the time to get back to our basics with COVID-19 safety precautions. Stepping up our efforts now will allow us to continue to keep the curve low, press it back down, and keep our communities safe and well. We can reduce our personal COVID-19 risks by using our layers of protection every day. A starting point for all of us is to remember that the more people we see, the higher our risk will be. When deciding where to go and who to see, we all need to take a moment to think about two things. We need to consider the risks we're going into. How many people will be there? What is the environment? Is it indoors? Is it outdoors? And we also need to consider the risks that we will be bringing with us when we leave. This will help us determine what is safe for us to do right now, and it may be very dependent on the things that we have done in the recent past. We know that our elders, our seniors, and anybody with underlying health conditions are at considerably higher risk of more severe illness with COVID-19. So if this is the case for you or for someone in your household, taking a step back from social interactions at this time is even more important. I have some practical examples that I thought would be helpful around what we've been talking about. Number one, if you or others in your household participate in sports, maintaining your distance on and off the field is important. And we've had some guidance. We've worked with sports organizations to make sure this can be done safely. But that means keeping your distance from other spectators or parents on the sidelines, if you are one of those. And socializing after the game needs to be avoided right now. But if you are out playing with the same group of people on a periodic basis with those guidance in mind, then it may be safe for you to do that right now. If you're thinking about your household safe six, then you want to pick one or two close friends or other families to spend most of your time with. That may mean that each person in your family has one friend versus six. It may mean that you partner with one or two other families that have children the same age that you can keep and have that agreement and talk to each other about how you will manage the risk and the relationships that you have. If your teenage son has a girlfriend, have a conversation with her family to better understand the circumstances in her family and agree on an approach that works for everyone. There are no hard and fast rules, which was what makes it challenging for all of us. But it is about understanding what the risk profile is for each one of us and our families, as well as understanding who we are going to be connecting with when we go out and the risks we both will be bringing with us and might be bringing home again. For all of us, it's about knowing ourselves and our families and our communities. It's about finding that balance that will keep our communities strong and everyone, whether at school, at work, at home, as safe as we possibly can. We need to protect ourselves, and at the same time, we need to take care. We need to take care of our neighbors, our friends, our loved ones. We need to remember how we did that early on in this, how we learned both to work together while staying apart, connecting socially while physically distancing. And we will get through this pandemic together. As busy as all of us might be, we need now to take a moment to think about how we are making a difference through our actions and make our plans as we head into fall, because we can all make a difference. And let's, of course, continue to be kind, to be calm, and to be safe. I will also note that we will be giving a written report on the surgery restart, as well as the progress that we've been making in hiring contact tracers and other healthcare professionals, and we'll be attaching that to our statement that will come out after this briefing today.